Hello, dear viewers. Today, we'll be talking about one of the most important topics in a woman's life, the early symptoms of pregnancy. Am I pregnant? Is a question many women ask themselves at least once in their lives, sometimes with hope, sometimes with anxiety. The best way to answer this question is by carefully reading the signals our body gives us. Let's take a closer look at these signals, the signs of early pregnancy. A missed period is usually the earliest and most common sign of pregnancy. Especially for women with regular cycles, even a few days of delay can be a big clue. During pregnancy, the fertilized egg implants into the uterus, and the hormone progesterone rises. This stops the menstrual cycle. However, not every delayed period means pregnancy. Stress, rapid weight changes, thyroid issues, or hormonal imbalances, like PCOS, can also cause delays, so this sign should always be evaluated together with others. What used to be a good morning might turn into something else. Even though it's called morning sickness, it can strike at any time of day. It usually begins between weeks 4 and 6 of pregnancy and often subsides by week 12, but for some women, it can last throughout the entire pregnancy. The rising HCG, human chorionic gonadotropin hormone, is the main cause. It can make your digestive system extra sensitive, and combined with a heightened sense of smell, leads to nausea and vomiting. Your nose becomes a lot more sensitive, and not in a good way. Suddenly, scents that never bothered you can make you feel sick. Detergent, coffee, meat, or even your partner's perfume might become unbearable. This is caused by rising estrogen levels. You might also experience intense cravings for sweets, pickles, ice, red meat. This is the body's way of signaling its need for certain nutrients. In the early weeks of pregnancy, constant fatigue, sleepiness, and low energy are very common. Your body is working overtime to support the development of new life. The increased progesterone has a natural sedative effect. Blood sugar and blood pressure may drop, and iron needs rise. That's why many women feel unusually tired, even with normal daily activities. If you track your basal body temperature daily, you might notice a consistent increase of about 0.3 to 0.5 degrees Celsius or 0.5 to 0.9 degrees Fahrenheit after ovulation. This subtle rise, caused by progesterone, can persist during early pregnancy. While not easy to notice unless you're tracking closely, it can be a helpful clue for some. Some women experience light spotting around the time of their expected period. This is called implantation bleeding and occurs when the fertilized egg attaches to the uterine wall. It is usually lighter and shorter than a regular period. Mild cramping may also occur, but it's generally not as intense as menstrual cramps. However, if there's any doubt, consult a doctor, as issues like ectopic pregnancy can also cause pain and bleeding. Suddenly want to cry or go from happy to angry in seconds? That's totally normal. The sudden rise in estrogen and progesterone affects brain chemistry and causes mood changes. These emotional swings are especially common during the first trimester. In the early weeks of pregnancy, your breasts may feel fuller, tingly, or sore. Your nipples may darken and veins may become more visible. This is your body preparing for breastfeeding. This symptom is similar to PMS but tends to last longer. In early pregnancy, the increase in blood flow and HCG makes your kidneys work overtime. Later on, the growing uterus starts pressing on the bladder. As a result, you may find yourself running to the bathroom more often, even at night. This symptom usually starts around week 6. Progesterone slows down your digestive system, which can lead to constipation. Gas buildup and bloating are also common. Eating fiber-rich foods, drinking plenty of water, and doing light exercise can help ease these symptoms. Other common symptoms: dizziness or headaches, metallic taste in mouth, dry mouth, mild feverish feeling, lower back pain, breakouts or skin changes, increased vaginal discharge. If you're experiencing several of these symptoms and have missed your period, you can try an at-home pregnancy test. For the most accurate result, use the first morning urine. However, a blood test at a clinic, known as beta-HCG, provides more precise confirmation. If you've missed your period, have a positive test, or are experiencing unusual symptoms, like severe pain or bleeding, consult a doctor immediately. Also, if you're planning to get pregnant, it's a good idea to see a doctor beforehand and start taking folic acid supplements. Pregnancy presents differently in every woman. Some may have no symptoms at all, while others might confuse them with premenstrual signs. Listen to your body, observe the changes, and never hesitate to consult a healthcare provider if you're uncertain. Don't forget to subscribe to our channel and like this video. In our next episode, we'll discuss healthy eating and what to expect during the first trimester. Take care and stay well.